Hello everyone, I am Dr. Sridhar. I'm a consultant in critical care and I head the ICU at Kaveri Hospital, Chennai. During these difficult times, one of the most common questions I'm asked about is the availability and value of the drug Remdesivir. Now, I deal with the sickest of the sick patients, and as we all know, most patients who get corona get better on their own. 98 to 99% of them require nothing more than home isolation and occasionally a tablet of paracetamol to treat the fever and body ache. Most of them get better on their own. For the ones that get sick and get admitted to hospital, as far as I'm concerned, a medicine only works if it does one of two things. One, it should stop progression of the illness. It should stop the illness from getting worse to the point that they require ventilator support. Two, it must reduce mortality. In other words, it must save lives. And so far, all the evidence that we have says that Remdesivir does not do either of these things. Remdesivir does not reduce the chance of the illness progressing to the point where you need a ventilator, which is a very important end point. Remdesivir does not save lives. Now, I cannot emphasize this anymore. I know there is so much concern among attenders of families running around trying to source Remdesivir when clearly we know that Remdesivir does not save lives. There have been a lot of studies done on Remdesivir. The biggest one is called the Solidarity Trial. It enrolled thousands of patients from 30 different countries at least, and it was backed by a reputed organization, WHO. And the conclusion from this study is this: Remdesivir does not stop the progression of illness. It does not decrease the chance of you ending up in ICU and needing ventilator support. It does not save lives. So please stick to practicing science, which is very clear on the medicines that work. The medicines that work predominantly are steroids and drugs that reduce the clotting in your blood. These drugs are widely available. There is no shortage for these. And these are the ones backed by science. And these are the ones that we should be using in these patients. Remdesivir is overrated and overhyped. Please let us use only the drugs that are proven by science to be effective. If at all there is any benefit in Remdesivir, it may reduce the duration of illness by a couple of days at most, and it may be used in people who are in hospital and who need a little bit of oxygen. Once again, Remdesivir does not work in the sickest of sick patients in ICU. It does not work in people who do not need oxygen. It may be used for slight decrease in duration of illness for people needing a small amount of oxygen, and this is the only group who may benefit from this. Let me emphasize once again, Remdesivir is not life-saving drug. Take care everyone, stay safe.